I'd like to review some of the methods for collecting disability data. What I'm going to cover in the next few minutes are methods that include censuses, surveys, the use of administrative data, direct assessments, and qualitative data collection methodologies. In terms of censuses, these are usually carried out every 10 years. And almost every country in the world collects census data. It's important for generating policy information or information that can feed into policies. And they usually cover, generally by definition, they cover everybody in the population. For example, I know that in India, a population of over 1 billion people, there are 1 million enumerators selected for collecting census data every 10 years. That's a huge team of interviewers that goes out to collect this information. But they collect information, as I said, on the entire population, and they include information about the social background of the population and economic characteristics of families and households. There are guidelines provided by the United Nations Statistical Division on principles and recommendations for housing and population censuses. Those are available online, and they include specific guidelines for the collection of disability data. Censuses have strengths and they have limitations, like any data collection methodology. And their strengths come from the fact that, or one of their strengths comes from the fact that they cover the entire population, as I said. They include everybody, and for that reason, you can do small sample analysis or small area analyses when you collect disability data through a census. They're conducted regularly with wide intervals, but every 10 years, countries collect census data. Sometimes every 5 years, but generally every 10 years. They are relevant to the population which is covered. So the questions on the census in the United States are relevant to the US population. The questions on the census in Malawi are relevant to the Malawian population. So they're contextual to the population to which they're being asked. And that's important for the policy implications that they have. The number of persons with disabilities identified in a census is usually large enough that you can make important conclusions and data analyses based on that population. Generally, the population of people with disabilities is about 10 to 15%, and you would need a large sample in order to make analyses by gender and race and urbanicity. But in a census, because you cover everybody, you've got the population base to make those analyses. Censuses are, though, not without limitations. And one of the biggest limitations in a census is the fact that there are limitations on the space, the physical space involved in the number of questions that you can ask. Because everybody in the population is being asked these questions, there's not a lot of time involved in interviewing. So the questions are limited. You can't get into depth on certain topics. They're costly and time-consuming. Because of the scope, it takes a lot of effort. They're not frequent, as I said, every 10 years. They're regular, but not frequent. And there's limited training available for the enumerators or interviewers on a census because they go out and basically collect the information in a matter of a day or two or up to a week. Not much time can be invested in training interviewers on specific topics, like, for example, disability. Now moving on to population-based surveys. These are large sample-based surveys that are representative of the population, but they don't include the entire population. So it's a sample-based survey, and that can be as large as many tens of thousands of households or quite small. They can cover specific topics like, for example, health or labor statistics or disability statistics, depending on what the the topic of the particular survey is. They can also be conducted periodically, which gives you some basis for monitoring progress on certain indicators like health coverage or education or labor statistics. General surveys ask questions about demographic characteristics of the household and household members. Who is in the household, what their age, what their sex, what their marital status is, whether or not they've gone to school, whether or not they're employed. And they can also go into living standards. What is the household like? What is the house itself like? So giving an impression of how people live. You can get that from a general survey. There is limited space for specific questions, so you can't go into great depths of information on, for example, disability. You can ask more questions than on a census, but it is still limited. And these surveys, as I said, can be done continually on a regular basis so that you can monitor progress over time. Another kind of survey is a disability-focused survey. And this gives you the best coverage of information on disability. You can ask specific questions about persons with disabilities, their families, their environment, which is very, very important, access to services, and their quality of life. All of that information involves multiple questions. And on a disability survey, you've got the ability to go into detail and get that information. The choice of who is answering these questions is very important. Generally speaking, children are not the best respondents or informants to questions in a survey about themselves or about disability. They have a limited cognitive ability to understand the questions and the response patterns that are required. I say children. Generally speaking, I would say those 15 and over would be reasonable respondents, but you have to take some care in interviewing children lower than 15 or lower than 12. Most often, a proxy respondent is used, somebody who knows the child, who knows the family, because these surveys are usually conducted with one informant, one person in the household responding for everyone else. And in that way, you get the best information and the most consistent information, because you're not dealing with multiple respondents. You're dealing with one person who knows the most about the people in the family, including children, elderly, whoever is living in the household. Using proxy respondents lower the cost of conducting a survey, and it's easier to administer. There are strengths and limitations to surveys, just as with censuses. In a survey, they are flexible in depth and range of the topics covered. So as I said, you can collect more information than on a census, and they can track progress over time. Whereas a census is 10 years usually between one and the next, a survey can be conducted on an annual basis or every 2 or 5 years, easier to track progress. Limitations to surveys are that samples of people with disabilities is smaller. Remember I said that on a census you're asking everyone in the population. In a survey you're doing a sample-based data collection, and there's no guarantee that the number of people with disabilities in the sample will be large enough to be able to generate reliable statistics. So you have to make sure that your sample is collecting the people that you want to include. There can be poor coverage on a survey. There are, generally speaking, populations that aren't included. Those include the homeless population, people who live in institutions, and refugees. If those populations in particular are important to your data collection, you have to take extra steps to ensure that they're also included. Household surveys are, as they say, based on households of individuals. Another important method of collecting data on disability is through administrative records. These are data collections to monitor and manage policies and programs for the most part, and they're collected for administrative purposes. For example, data from assistive device programs that provide, for example, wheelchairs to people who need them. There'll be a register, an administrative system to cover the provision of those services. Early childhood centers, early childhood education programs, rehabilitation programs. Those are other examples of administrative systems that provide services to people with disabilities who need those services. The strengths of administrative systems are that the information can be used for service provision. That's the prime goal of administrative data. But the limitations include the fact that they're not collected for statistical purposes, in the sense that you can't generally make comparisons between people with and without disabilities in an administrative system. They're set up for a particular population of people who need wheelchairs, for example. Will only include those individuals. And you can develop statistics based on the provision of services to that population, but broader generalizations about people with and without disabilities can't be made through administrative systems. They may not provide the most accurate information on people with disabilities who don't know about the services. If you're not familiar with the services that are being provided, you have no reason to become registered. So they only include those who have access, who have knowledge and access. If you're living in a rural community with no access to a city and an administrative system, then you have no incentive, really, to go and become registered. So you're left off. Even though you might benefit from services, you wouldn't be included. There's less than universal reporting by schools, by health centers. It depends on the administration itself, how these data are collected and monitored. And as I say, they miss people not receiving benefits who might need them. Another way to collect information on people with disabilities is through direct assessments. So far, we've been talking about collecting data through sample-based questionnaires or census questionnaires, or even administrative questionnaires and records. But direct assessment takes the individual themselves and puts them through a series of tests or procedures to find out firsthand how they're functioning. It would mean something like going to an ophthalmologist and getting your vision tested. That's a direct assessment of your ability to see. The same with audiometry and hearing tests, or just an observation of how you walk, how you're able to move about. Those are direct assessments. And for children, that's important because it's one way to identify children who haven't been identified as having a disability. Often with children, disability is first identified when they go to school. And you may think that that's odd, but until a child is sitting in a classroom and is required to listen and read, and they're in that learning mode, that's when parents learn that there may be decreased vision or decreased hearing that needs attention. That's the first, perhaps, direct assessment by a teacher of the child's ability to function compared to other children in the same situation. Direct and natural observations of functioning and behavior in everyday situations can include in group settings, like in schools, or with the assistance from family and assistive devices. Links to individual treatment and interventions are then possible. So we're talking about an individual. We're not talking about a population of people with disabilities, but an individual child, an individual person who has difficulty functioning and needs an intervention. These methods for direct assessments might include observation, a checklist, an interview, or a rating scale, something that is set up to follow a person through a series of activities where they can be monitored. The strengths of direct assessments are that they assess body functions and capacity directly, as it says. It allows for the identification of individual cases for immediate follow-up. So again, we're focusing on the individual, not a population. But there are limitations to direct assessments. Young children can be difficult to test. Anybody who has a young child themselves know that they can be difficult to sit and go through a series of tests or questions or scales in order to monitor their functioning. Ratings can be subjective. It's not general objective scales or ratings that are used to carry out these assessments. So there is a subjective measure involved. Behavior at the time of the observation may not be typical. We know children's behavior can be erratic at times. Anybody's behavior can be erratic at times. And in a test situation, it may be unnatural. There are heavy implementation requirements. There's usually equipment that's necessary for direct assessments, and that may not be easily accessible to all populations. And assessments, because they are individual, are not generalizable to the population. So we're not talking about population statistics here, but individual measures. The final example I want to talk about are qualitative studies. So far, we've been talking about measurements, whether it's an individual or a population, and the generation of numbers, of data. But sometimes you want to know a little bit more about a particular individual or their life situation. And you get that information through qualitative assessments, through sitting down with the person and asking direct questions and follow-up questions to learn more about what their experience is, why they experience environmental barriers, or how those barriers affect their participation. Those are important elements in understanding the disability continuum, if you will, and we'll talk more about that in future videos. But it gives you in-depth information about the person and what they're experiencing. As far as strengths are involved, they provide these qualitative assessments, provide explanations for the quantitative information you may have gotten through surveys or censuses. For example, a qualitative study perhaps can reveal that community members perceived blindness from cataracts as a curse on the family, and that this type of blindness is incurable. You might find that out by interviewing families or communities when cataracts can be cured, in fact. And that would be a prevention or a means of preventing families from going to eye care facilities for treatment. So you get kind of stories, narratives behind the situation that people are actually experiencing. And I think that's important. Because these involve more in-depth interview techniques, more narratives, smaller sample sizes are necessary. You don't need a lot of people, but they're again not population-based per se, but more directed towards the individual. Sometimes you can make conclusions based on a community's understanding of a situation, like with the cataract experience I just explained. If that's a community or a societal understanding, then you may be able to make more generalizations. But for the most part, these kinds of findings are not generalizable. Data analysis and interpretation requires more time and is not as straightforward as data analysis using quantitative methodologies is concerned. So in conclusion, I just want to be able to say that there are multiple methods for collecting data on disability from different types of information sources. When you begin, the aim of the study will guide which method is utilized. So up front, when you're planning your data collection exercise, you should try and think about what kind of information you need, and that will guide you in determining whether or not you want to look at a survey methodology, if you want to be able to start looking at administrative data, or if qualitative means and measures are the way to go.